Dermatology Associates of Western Connecticut is proud to introduce a new machine to our patients. It's called the Icon Aesthetic Platform, and it is a machine that allows us to plug in different handpieces that have different capabilities. So the first handpiece is our Max G. That is our intense pulse light, or IPL, and it's used to deal with photo damage. We call it a photofacial or photorejuvenation. It goes after reds and small blood vessels on the surface of the skin, so telangiectasias. It goes after the flushing and redness that is associated with rosacea. It could also treat some birthmarks called port wine stains. Of course, it can go after browns, so everybody has their brown spots or lentigines. These are spots that can be treated on the face as well as off the face. So we are talking about the back of the hands, the chest, the neck area. It generally tends to be a series of treatments, sometimes up to 4 treatments, because it is a pulse light and not a laser. It has the ability to blend with the treatments versus just spot treat. What brings you in today?
Well, when I look in the mirror, I see a lot of redness on the cheeks, on the nose, and some days worse than others.
Okay. Are you able to have downtime, or are you looking for something that has minimal downtime?
Yeah, I would prefer something with minimal.
So what I would recommend, based on what you're asking for, is something called intense pulse light. Intense pulse light is actually not a laser, it's a light device. This has multiple bands of wavelength, so it allows me to treat multiple depths of the skin, but go after specific targets. Downtime is minimal. Basically would expect that your things are going to get a little red, get a little puffy. It is a little uncomfortable, but it's not undoable. We typically, to help you, we have a cool roller that we'll use on the skin as we're doing the treatments. Your restrictions are very minimal. You're going back to your normal routine. We ask that you gently clean the area. We ask that you use good moisturizers. Of course, we're going to tell you wear sunscreen. The first few days you may be a little redder and a little puffy. So generally after a single treatment, we would recommend that you come back in about 4 weeks with a single treatment. If you're lucky, you can get up to 50 to 70% improvement. But if you still have some more to do, then we can repeat the treatment again. Okay. The other handpiece is our non-ablative fractionalized laser handpiece. And so this is a laser. Non-ablative means it does not break the skin. Fractionalized means it takes little microbeams of laser light within the spot size. So instead of treating the entire spot, it's picking out certain areas. And that's what fractionalized means. And resurfacing is basically anything that causes thermal heating, coagulation deeper in the dermis is going to create a collagen stimulation. And new collagen is created, which of course new collagen is young collagen and can cause tightening and improve the texture of the skin. We can use this not only for wrinkles, but now we can also use this for any types of scars, surgical scars, acne scars, chickenpox scars, burn scars, and we are also using this on stretch marks. Like with all of our procedures, treatment begins with a consultation. And if you are in the middle of a series of treatments, this is a good time to talk about the progress.
I've had 2 treatments in the past. Downtime was very minimal, which was good. I was slightly red, but nothing that I wasn't able to cover up with some makeup. And as far as puffiness, a little puffy around the eyes, but again, I just did some cool compresses, and within 2 days it was subsided. I did have some scaling, some dry skin, but that took about a full week to really resolve.
Okay. And what kind of benefits, if any, have you noticed?
Definitely the skin tone, it's more even. I'm actually able to go out without some makeup, which I've never been able to do before. So now with those benefits, I feel that this is a series that I'd like to continue with doing. Okay. So, you know, I've seen some benefit now, so I only can imagine there'll be more benefit down the road.
So as you remember, the first thing we're going to do now that your face is clean is we're going to apply the topical numbing cream. This is a product that we apply to the skin. It should stay in place usually about 20 minutes, and that will help decrease any of the discomfort that's associated with the treatment.
Okay.
Once the cream is removed, both the patient and doctor put on eye protection and the procedure begins. The laser treatment itself only lasts a few minutes. During this time, a laser handpiece is applied to the treatment area in a number of successive paths, dependent on the treatment course. While there is some discomfort, it should be minimal. You will feel your skin heat up as the treatment stimulates the regenerative properties of your skin. A cooled roller is applied directly to your skin to soothe the skin and quickly reduce the temperature. After the treatment, you will be able to quickly return to your normal routine. So people will say, is this procedure right for me? I feel that because we have the ability to treat multiple different things, it really is right for all patients, young, older, all skin types as well. So anybody that's interested in improving their skin in many different ways would benefit from the treatment with the Icon Aesthetic platform.